Bob and Brad, the two most famous physical therapists on the internet.
Hi there, folks. I'm Bob Shrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to show you 10 bone health exercises for your core and lower body in bed. It's for beginners. If you have osteoporosis or osteopenia, this is very good for you. We did one for the upper extremity already, so you can check that out if you.
So the arms.
Right. But we're going to do one more for the core and lower body. These were developed by Sarah Meeks. She's the expert on osteoporosis as far as exercise is concerned. Been doing it for 400 years.
Right.
She's
got a good sense of humor.
Yeah,
she'll take it.
She'll take it.
But
right.
she is about 80 now, isn't she?
She's 80. Yeah.
Very
and
spry.
still working hard.
Yeah, very, very. Go get them.
By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, go to bobandbrad.com. Go to the giveaway section. We're always giving something away.
Right.
What are we giving away? We don't know because this is a future video. So you can also go to Facebook. It'll be pinned to the top of the page, the contest that is. Go to Twitter, Instagram, or TikTok if you want a 60-second version of our program. And what else do we have, Brad?
We have a podcast, Bob. Not to mention a podcast.
All right, I'm just going to show you these exercises. I'm not doing them in real time, just showing them and we'll explain them.
So these are, you said, in bed?
Yep, and for beginners. So these are hook line. What we're trying to do is get a little motion in the bone, but while I'm doing it, I'm pushing the shoulders into the bed.
So, yeah, there's a lot of, most all of these are promoting posture in one way or another, which is really critical for osteoporosis because it takes pressure off of those bones.
This is really a good one, Brad, to do when you wake up in the morning because your bones and joints are often very stiff from lying all night. So you're going to loosen it up by doing so. All right, next one is...
How many of those? About 10?
10.
Yep.
Chin tucks. So now, if you are of the nature that you have a forward head posture and you can't even get your head down like this, you're going to try to do a chin tuck like this. Do you have one?
What?
Oh yeah, you could use a pillow. And if your head is just way forward like this, you maybe start with a pillow or a rolled towel.
Sure.
But you're going to do some of those chin tucks. You're starting to realign the spine, realign the neck, and you're stretching out the muscles that'll help keep your head aligned the way it should be.
Because when some older people, their head is forward, it's kind of stiff and it won't flatten out as you would like it to.
All right, next one, you're going to take your hands, you're going to put them behind your neck, you're going to squeeze and push the elbows into the bed.
So back down, and then you can see arch in the
5.
back a little bit.
1, 2, 3, 4, 5. Great posture exercise.
Make sure you breathe on each repetition. Breathe in and exhale. Bob's doing a good job of it right now. Good.
With all these, you can do about 10. If you want to do less, go ahead. If you want to do more, go ahead. Next one, leg lengthening. So you're actually gonna squeeze or bring the toe towards you, but it's like you're trying to lengthen the leg. You're trying to make it longer.
Yeah, so you're gonna feel it kind of in here. Straighten the knee out. Pull the toes this direction towards your nose, and you'll feel a nice stretch. This is a great stretch for that heel cord too.
Yeah, heel cord, and also stretch to the leg. And I used to be only 5 feet tall, Brad.
Well, then you started doing this.
6'6", yeah.
Well, there you go.
So it works really well.
That's a good testament.
All right, leg press. So now this one leg up, one leg down. You're actually going to press the leg down into the bed.
So the straight leg on the bottom, just keep it.
I'm pushing it right down to the bed.
Down this way.
Count to 5, and then switch to the other side. And push down into the bed. 2, 3, 4, 5.
So we're going to do 5 to 10 on each leg,
sure,
depending on where your comfort level is.
Exactly. Pretty exciting, isn't it, Brad?
Yeah, that's right, Bob.
All right, next one. We're going to do the box squeeze. So in this position, I'm going to have your legs straight.
Yep.
And I'm going to squeeze my buttocks together. So it's like you're trying to hold a quarter in,
I thought you said the box squeeze.
Box squeeze.
Is that what you said?
No, buttocks.
Oh, the buttocks. Buttocks.
Not box.
Yeah, so you're just going to squeeze those butt cheeks together. Yeah, the old therapists, I've heard so many therapists tell their patients, pretend there's a quarter in your gluteal cleft, which is your butt crack, and squeeze like you're going to hold it there. And it really works well. It gets those glutes really working.
I really feel bad for those plumbers. The old plumber joke, you know. So next one, Brad, we're gonna go ahead and just put your hands on your side like this, and you're
Yep.
gonna squeeze your shoulders back into the mat again.
So down here
Yep.
and a little arch in the back. as
Little
you're-
arch in the back.
Yep. Yeah, that's kind of subtle. Can you see that, Tanner? There? So moving up this way, shoulders are going back down in.
All right. I gotta see what my next one is. Oh, bridging. We're gonna go ahead and do some bridging.
Breathe between each one.
This is nice for the core too.
Yeah. You do have to be careful. Hopefully your feet won't slide away. Sometimes that happens.
Right. And
Um,
you don't be too close to the edge of the bed if you're
Right.
on the bed. You can certainly do these on the floor. Um, it'd probably be better if you can get down on the floor.
Right.
So, do you know that I just read that a lot of, I think it was Chinese, sleep on the floor, and for that reason, they not too many of them fall out of bed because they're on the floor and they know how to get up off the floor.
Sure. Well, that makes sense.
So, all right, belly strengthening. So you're gonna be like in the hook line position, and you're just gonna go up like this.
What's life going to be like in 5 years from now, Bob?
What are you talking about?
Oh, now we're doing yeah,
Some abdominal strengthening.
yeah, yeah. And it's good range of motion for the hips.
Are you talking for us? What's gonna be in
No,
5 years?
no, Bob. No,
For the world?
Just, forget I even said that.
What a weird
What are
thing
the
to say.
what do they call those mattresses that are very hard? I slept on one. I'd never sleep on one again. But I thought it was a Chinese, came from the Chinese culture. I'll think of
You
it.
got me on that one. All right, final one we're gonna do, Brad. The prone, and let's see.
Arms by your side.
Arms on the side, right?
Yep.
And so I'm like this, and I'm lifting up like this,
Can you look
Squeezing
up
the
a little
shoulder.
bit if you want,
like this.
depending on how your neck feels?
I think
Sure.
it's better this way.
Okay.
You're strengthening then the extensors there too.
Sure. This is going to be difficult for some people, particularly if you have a rounded back or some kyphosis, which people in their 60s and 70s, it's maybe starting at that time. So do the best you can. Turn your head to the side if you can't get your head up so you can breathe.
Look like a fish.
Yeah. And that's
All right,
it.
That's it. That's
All
number
right.
10.
There you go. Those are nice exercises.
You
Do
know,
the best you can. If you can't do some of them, that's okay. Just go to the next
Yeah,
one.
if you don't like them, just skip that one and go to the other ones. But again, it's for beginners and it's easy enough to do.
Yep.
My mom could do this. She's 90 years old.
Oh,
But
are you going to show her?
well, yeah, I'll show her some of
Oh,
these.
good.
So
Excellent.
take care.